everyone, today I'm going to show you my treatment plan for Achilles tendonitis. So the Achilles, or the calcaneal tendon, is right here. As we know, an Achilles heel is a weakness. So as you can imagine, Achilles tendonitis is something that is very sore. So what we will do first is we will look for signs of redness, heat, and swelling, as these are indicative of inflammation. And as we know, as massage therapists, inflammation is a sign that is directly contraindicated. We don't want to massage anything and make it worse. So that would be the first thing we would do to assess the area. Now, once we've assessed the area of the calcaneal tendon, we would want to do some light friction and circular motions on either side of the tendon. It's very light. We don't want to elicit so much inflammation that we're causing more pain than we are assisting in helping the problem, helping the body to heal itself. So we're warming this tissue, and as a result, the area superior can be worked with a greater amount of pressure so that the affected area down here doesn't feel a pulling sensation when we're working it. I'm just going to work this area and warm it, and I would say that I would do that for an approximate maximum of about 3 minutes. Just really want to get in there. We really want to, with those circular motions, warm this tissue here. Now, while we're working here on this tissue, we can actually use our knee and very lightly dorsiflex the foot toward the bolster. Just want to lightly do that as we work in circular motions. So once this area has been appropriately warmed and loosened, then we should proceed up the calf gliding. So I'm going to drape my client to where I can get into her calf muscle, just like this. We're going to work this calf. Now this can be done with a pretty firm to deep gliding pressure, making sure that we work that gastrocnemius and soleus. That's where we really want to focus a lot of our pressure. Always making sure to use upward motions, pushing the blood volume to the heart, unless the patient has a clotting disorder or they have certain medications that they are on, like blood pressure medications, where they shouldn't be worked in an upward fashion. So here I am coming in to that gastroc, gliding up and getting into that soleus. We also want to make sure we can reach under too and off to the sides. Work those fibularis muscles and that tibialis anterior. Never hurts even when your client is facing a certain way, as this client is facing prone, to work the muscles underneath. It makes the massage a little less predictable, when we shift our direction. And it also works those tissues that could potentially become irritated because of one small area being irritated. So because we are treating a specific problem of Achilles tendonitis, we'd probably work this area focused for about 10 minutes. Now obviously I haven't worked here for 10 minutes. You would definitely want to make sure you're feeling the tissue warm and loosen under your fingertips. So now what I would do is I would come and I would apply a myofascial release to the client. Now, the client already has some lotion on her leg. She already has some lubrication here. So So what I'm going to do is I'm going to get 2 pieces of tissue. And place my hands on them and do a cross myofascial release to the area. Now fascia is a connective tissue and it can take up to 10 minutes to release. I see my upper fascia here, focused on where my right hand is loosening much quicker than my lower fascia. I'm not really applying any pressure. I'm not applying any push. I'm not applying any directionality to these releases. I'm just letting the fascia, there it goes, fall into the, loosen into the direction to which it was just loosened. Now here goes the other one. What is amazing is this same fascia that's in your calf is the same fascia that's in your upper right shoulder. Here it goes. It's slowly sliding off. This one's going off to the side. There it goes. And I just let it fall. So that fascia released pretty quickly. And I would say that the reason this fascia released pretty quickly is because I did a lot of work to the tissue in here, and I filmed some videos prior to this as well. So this tissue is nice and warm right now. So after this video is over, I'm going to owe her a massage on the other leg. But I would say that that's why the connective tissue or fascia loosened quite nicely here. Now I would finish up by doing some compression to the leg as I feel that compression gives a nice closure, a nice finishing, secure sensation to the end of the massager, to